During this webcast, I will ask experts about what's being recommended to lower the risk of getting or spreading germs at CF clinic or in the hospital. To learn about CF germs, nutrition, how to partner with your care center for improvement, and the latest in CF research, watch an archived webcast on the CF Foundation's website. Now, joining me today are Doctors Lisa Seaman and John LaPuma and respiratory therapist Kathy O'Malley. Lisa is a professor of pediatrics, a specialist in pediatric infectious diseases at Columbia University Medical Center, and a hospital epidemiologist at the New York Presbyterian Morgan Stanley Children's Hospital. John is a professor of epidemiology and pediatrics and the director of the Cystic Fibrosis Foundation's Burkholderia Cepacia Research Laboratory and Repository at the University of Michigan, Ann Arbor. Kathy O'Malley is a CF respiratory specialist at the Ann and Robert H. Lurie Children's Hospital of Chicago. Welcome, Lisa, John, and Kathy. Now, the first set of questions will focus on CF clinic, and then the questions will be about the hospital. So my first question is, as we all know, people with CF go to CF clinic on the same day. So what is being done to minimize the risks there?
So Eric, as you mentioned in your introductory comments, the purpose of today is to talk about ways to prevent people with CF from getting germs from others with CF or from spreading germs to others with CF. And we focused a lot of our recommendations on CF clinics. So first, we recommend hand hygiene. And we recommend that people with CF and their accompanying family members and friends perform hand hygiene, usually with alcohol in healthcare settings, when they enter the CF clinic, and any time their hands may become contaminated with respiratory tract secretions. So for example, after coughing, after performing pulmonary function tests, and then before they leave the clinic, they should perform hand hygiene again. Second, we actually are recommending that people with CF wear a mask when they enter CF clinic. So I've actually brought a mask that we use at our hospital. There are other designs for the mask. Some of them have an elastic earpiece that goes around. This one has a special part that will actually mold to your nose. And there are masks that are quite a bit smaller than this one that can be worn by very young children. Next, we recommend that the CF clinic staff schedule patients in a staggered fashion in efforts to minimize waiting time within the waiting room. Thirdly, we recommend that children should bring books with them, iPads with them, things that will entertain themselves while they're waiting, because sometimes the clinic visits can be long, and that they should not utilize any of the common toys or books or computers that are available in the waiting areas. Next, we recommend the practice of respiratory hygiene, and that means covering your cough, ideally with a tissue, discarding that tissue in a wastebasket, and then, as we mentioned earlier, performing hand hygiene. And finally, people with CF should stay 6 feet apart from others with CF.
What are the recommendations for lowering the risk of CF germs in the individual clinic rooms between people with CF? How do people know they're clean?
Well, the CF clinic staff should wear gowns and gloves when they're caring for people in that room. The room should be cleaned in between patients, and particularly any high-touch item or surface should really be thoroughly cleaned in preparation for the next person being put in that room.
What about CF germs in the PFT lab?
So we have provided several options for performing PFTs safely, because one solution may not fit every single CF center. For example, some CF centers may do portable PFTs in the exam room at the start of the clinic visit using a portable machine. Others have special air handling systems in the PFT rooms that clears the air frequently. And the outsides of the machines always have to be cleaned in between patients. And as John just mentioned, the personnel that are performing the pulmonary function tests also have to wear gowns and gloves.
So what can people with CF and their families do when they don't see staff wearing gowns, gloves, and doing proper hand hygiene?
People with CF should remind the CF care team to perform hand hygiene, to gown, to glove. People with a child with cystic fibrosis should feel free to do so. If they perhaps practice what they might say in the event that somebody doesn't gown and glove and perform hand hygiene, That might make them more comfortable. Another idea is to do nonverbal cues. For example, if somebody is not wearing a gown, perhaps you could do that to indicate you don't have a gown on, or you didn't see somebody wash their hands and you're concerned about that. Perhaps you can mime that they haven't washed their hands.
What about the hospital setting? Do the same rules apply there? Gowns, gloves, hand hygiene?
Yes.
Why do people with CF have to be isolated when they're in the hospital? Can they get out of their rooms for more than just tests?
Well, this will have to be decided on a case-by-case basis. Remember that in the hospital, lots of people, even those without CF, are on contact precautions, and this is a very effective way to prevent spreading germs. The hospital's infection prevention and control team can work with the CF team to see if there are safe ways to have people leave their room while they're hospitalized. We know that being on contact precautions is difficult for everyone involved. It's not pleasant. But we will try to, again, make it as less unpleasant as possible. People can have visitors come in, they can bring items from home. So those are things that hopefully will make the stay less difficult.
Kathy, how are nebulizers cleaned and disinfected while in the hospital?
In the hospital setting, there are two recommendations for nebulizer care. One is for reusable nebulizers, and one is for disposable nebulizers. The disposable nebulizers can be used and reused for up to 24 hours. After each use, it's recommended that the residual volume be rinsed out with sterile water and that the mask or mouthpiece be wiped with an alcohol pad. This nebulizer that is disposable needs to be disposed of within 24 hours. The reusable nebulizer, that's a nebulizer that is very similar to what's used in the home setting. That is not designed to be disposed of. Instead, after each use, it's to be cleaned, disinfected, air dried. Now, there are a couple of general recommendations for safe nebulizer care in the hospital, and that is that nebulizers are for single patient use only, so never share. That when handling the nebulizer and dispensing medications, that clean technique is always followed. And finally, that medications that are in single-dose vials are preferred.
Is there a way to provide cross-infection education to hospital staff?
It's a very important question, Eric, and why we've emphasized so much in the recommendations that the CF care teams partner with their infection prevention and control teams. As John mentioned, we spend a lot of time and effort preventing germs from spreading among people without CF, and the infection prevention and control teams have a great deal of knowledge in this area. But I'll emphasize again that people with CF and their families can help in these efforts too.
My last question is also for you, Lisa. What can people with CF and their families do to make sure all staff, hospital and clinic, are lowering the risk of spreading CF germs?
So we have emphasized that education be developed for people with CF and their friends and families. And we've also emphasized that people with CF and their friends and families help their individual CF care teams to develop this education. It's very useful to have family members on advisory boards and give the CF care centers feedback and suggestions to improve infection prevention and control.
This concludes the CF Foundation CF Education Day webcast. I'd like to thank you for watching, Lisa, John, and Kathy for answering the questions, Rick Vasta and the technical crew, Melissa Chin, Genentech and Gilead for the unrestricted educational grants, and the CF Foundation for making this webcast possible. Thank you.